This is Veterinary Vertex, a podcast of the AVMA journals. In this episode, we chat about heart rate variability derangements in dogs with Chagas disease with Roy Madigan.
Welcome, listeners. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Roy, thank you so much for taking time out of your busy schedule to be with us here today.
Thank you, Lisa and Sarah. It's a pleasure to be here.
All right, let's dive right in. So, Roy, your JAVMA article discusses how heart rate variability analysis may enhance early detection and management of Chagas disease, which is an emerging One Health issue, by addressing underdiagnosed autonomic and cardiac dysfunction in dogs. Please share with our listeners the background on this article.
Thanks, Sarah. Yeah, so for those listeners that don't know much about Chagas disease, or if you were like me and you kind of slept through that section in parasitology, just a brief background. Chagas disease is a parasitic disease, okay? It's caused by a protozoal organism called Trypanosoma cruzi. So, not a virus, not a bacteria, but a tiny little microscopic bug similar to Toxoplasma, Leishmania if you're over in Europe. And so it's pretty widespread as far as southern United States. The southern 26 states, including Texas, which is where I practice, is just inundated with it. And it's mainly because we have the vector. And that vector is called the kissing bug or the triatomine bug. So it's a little bit bigger, or probably similar in size, depending on where you are, to a cockroach. But it's like a giant mosquito. It crawls, it flies, and it takes blood meals. And so wherever we find that vector, we're going to find the disease. Generally, we're taught in veterinary school that it's a disease of third world countries. And so, Central America, South America, but we have quite a bit of it. Essentially, what happens is the parasite is in the hindgut of this kissing bug. So it's actually not transmitted through the bite of the bug, like heartworm disease, but it's spread through the feces. And so when this kissing bug takes a blood meal from its host, whatever mammal it decides to do, it'll actually defecate. And that in that feces, the parasite is transmitted into the bite wound and then gets into circulation. That's the classic transmission. Other methods are a little bit more effective in our companion animals because they eat everything. If you have a dog, you know how it goes. They eat everything smaller than themselves, especially when these bugs have a nice crunchy center with blood in it, right? So major reinforcement there. And so these kissing bugs are commonly ingested through the oral route. Other methods of transmission include vertical transmission, so from the bitch to the babies. We also had through blood transfusions. Obviously, that's much less common than on the human side. And we also have carrion ingestion, so eating stuff they're not supposed to, which I'm sure your dog's never done before. And so those are pretty common methods of transmission. The parasite is very, very effective at getting into all tissues. So one common misconception with Chagas disease is that it only goes to the heart. We tend to look at the heart a lot because any amount of myocarditis is bad, but it causes inflammation in any tissue that it goes to, including the heart for myocarditis. And so the disease that it causes is pretty simple, okay? It generally causes a progressive chronic myocarditis, okay? If you think of it that way, there's kind of like three pillars that it operates in, okay? So by presence of the parasite, we cause tissue damage. So when those cells get ruptured, they die, right? Regardless if it's in the liver, the brain, the heart. The second thing that it does is it causes inflammation, or what we call the host immune response. And so the body's response to the disease or the parasite itself causes damage. And then the last thing that it does is it causes some microvascular disturbances. So tiny little microclots and all the wonderful things that those do in tissues, okay? But the end result when we're talking about the heart is generally systolic dysfunction, eventually electrical disturbances, which is huge, okay? And then, over time, we can get these autonomic disruptions. So our paper really focused on these autonomic disruptions that happen. So more of a nervous system effect. It really hasn't been looked at in dogs. And so that's what kind of drove us to do this paper and gather this data, because we wanted to see, we know it happens in humans, but does it happen in dogs? And so it was very, very fun to explore that.
Yeah, thanks. That was a great review. Appreciate that. So what are some of the important take-home messages from this article?
Yeah, I think the biggest thing that I'd like to share with veterinarians, we obviously in private practice don't do too many Holter monitors, right? But certainly everybody has access to EKGs, ECGs, and hopefully most of you are using those now. Back when I graduated a long time ago, Not too many of us had ECGs for surgical monitoring, but that can be your most reliable indicator of early detection for Chagas. Classically, this disease is diagnosed through serology, so we're going to be checking the body's response to the parasites. We're not looking for direct parasites necessarily. We're looking for the antibody response, right? So, but the biggest red flag, at least in our hospital, probably a third of the cases that we diagnose are under anesthesia with arrhythmias. And so there's a lot of papers out there that look at arrhythmias, the types, the frequencies, all that. But the biggest surprise for me with this was that heart rate variability analysis, which is just it's just a fancy term and a set of tools that measure autonomic function, okay, in the heart. So, sympathetic versus parasympathetic. And there's these distinct markers that have a lot of abbreviations. There's a lot of math involved with it. But essentially, at the end of the day, these just reflect the function of that autonomic nervous system. Okay. So the big take home is, let's kind of expand our knowledge when we're looking at these Holter reports, when we're looking at HRV analysis, instead of just glossing over it and ignoring it, kind of really give us some thought there. If I see a derangement, if I live in an area that's endemic for Chagas disease, again, it's like if you're south of Oregon and south of Pennsylvania, you're in that region, okay? Or if you have a dog with a travel history, maybe they adopted the dog from the south. Maybe you're in, like, I've got a dog in Singapore right now that we're treating. I mean, how did that happen, right? So th- people travel around the world, and so if I have an abnormality in my physical exam and I'm doing a Holter monitor, or maybe the cardiologist is, give some extra thought to that and consider maybe I'm dealing with Chagas and I need to do a test for that.
Yeah, fascinating. We recently did a podcast on Rocky Mountain spotted fever and how it's creeping its way into places that it never was before either. And I think that podcast and your article and this podcast also really highlight how important the role of the veterinarian is in these One Health situations, to recognize it in the animals as well as in people.
Yeah, Lisa, you bring up a fantastic point. Dogs are sentinels for this disease across the world. We know that. So when we look at dogs with Chagas disease, it's always associated with a higher risk of infection in their human counterparts, right? And, let's face it, when we were growing up, dogs lived outside. Now they live in our bedroom, right? And so they bring in all kind of fun creatures, including kissing bugs, these little vectors. And we see them, and our clients see them in their bedrooms, and they don't live in thatched huts, right? And so I don't know about you guys, but we were incorrectly taught in vet school, and still are to this day, that this is a disease of third world countries. This is not, you can live in a gated community and that gate won't stop these kissing bugs, right? And so we got to be aware of that. So the One Health implications are huge, and over the course of 20 plus years of diagnosing and treating this disease, I've only, and we're talking thousands of dogs, okay, but I've only had 6 people that tested positive. However, they would not have gotten tested if their dogs didn't have it, and so hopefully, their physicians were able to intervene and help these people. And as far as I know, they're all alive still. Um, so, but dogs can help. Dogs can help us diagnose. Other mammals in the pack. We've had a lot of cats, we've had a lot of horses, and again, they would have gone undiagnosed. In fact, in my own pack here, I have 3 dogs. I know that's weird, a veterinarian with only 3 dogs. We one of our dogs, our golden retriever, during her surgical procedure at 2.5, we noticed an arrhythmia that triggered us to test. She almost died. She was in VTAC on the table. That's not fun. But we diagnosed Chagas disease on her, and that triggered me to test the other dogs, and they were also positive. So, early detection is key, and I think this particular set of indices, this heart rate variability, looking for arrhythmias on your EKG or Holter is huge, and it's going to help us diagnose more patients for sure.
What sparked your interest in Chagas disease?
Yeah, that's a hilarious question because, as you know, I literally did sleep through this in parasitology because I said I'm never going to
Same.
practice in South America. So I apologize, Dr. Craig at Texas A&M. Um, it just it kind of fell in my lap, and my staff's lap. I mean, I have an amazing team at work, and they're very very loyal and have stuck with me a long time through this and have kind of experienced this, but Long story short, we had a dog, 1-year-old dog come in from the Humane Society. Actually, his name was Max. I'll never forget him. He was my gateway drug, and he came in with a tachyarrhythmia, and we were unable to save him. Any drug we gave didn't work. He succumbed, and so I couldn't sleep. The next morning, I came in and I was like, God, we've got to figure out what's going on here. So we did a necropsy. The shelter was kind enough to let us do that, and we salved tissues and looked at everything. Dog had a giant dilated purple heart, heavy, heavy, heavy on the cut surface. We sent it in for histopath. It took him weeks and weeks and weeks, lots of internal meetings. This is about 25 years ago, well, about 23 years ago, and the end result, a month later was, hey, this dog had T. cruzi infection. Chagas, what? I had to go dust off my books, right, and go to that short 3-paragraph discussion that we had in parasitology, and it shocked me, and I was like, wow, how many cases? Immediately my head went to how many cases, how many dogs have I been seeing with heart disease or not heart disease and been missing these? So that started that process of, it's the old adage, right? It's like if you don't look for it, you never find it, so you never think you have it, right? So we started looking for it. And, one thing that I would advise veterinarians, as you go into the Chagas world, it's like the Matrix, right? Once you take the red pill, you're toast. You can never go back. So fair warning, I warned you. If you want to find Chagas disease, the easiest way to find it is, and we all have these cases, just go back to your heart disease patients that you're managing right now. So do a little who got on your inventory, on your practice management software, and look at hemobendin. Whoever gets that, you need to go test them, okay? This disease is a great mimicker. We've got plenty of dogs with mitral valve disease with Chagas. We've got plenty of dogs with DCM with it, okay? And that's not even going into the realm of cats, but that's the easiest way to start looking for Chagas disease. So that one little dog, Max, that's what started the whole journey, and unfortunately haven't looked back yet. So
Well done, Max.
yeah.
You said it's, like 23, 25 years ago, and then you write this fabulous article. Even though you're a key opinion leader with all that experience, we always find something surprising when we're putting a manuscript together. Was there anything that stuck out in this manuscript as surprising to you?
Yeah, that's a great question, Lisa. I never cease to be amazed. I think that's why I still love my job. 24 years later, you can always find some things to challenge you on a daily basis. The biggest surprise for me was how widespread this autonomic dysfunction is, okay? And the second key point is it didn't matter if the dog was asymptomatic versus symptomatic, okay? We're going to find the same amount of, or not the same amount, but we're going to still find arrhythmias. We're going to still find the same amount of autonomic disruption in there. And it precluded, symptoms. So you got to understand these, like historically people come in and they're like, my dog's fine. Okay. I'm only testing because, my fourth dog has Chagas. And sure enough, they have Chagas, and I go through the history again. Are you sure? Are we, lethargic, decreased activity, collapse, anything, nothing, nothing, nothing. My physical exam is normal. My clin path is normal. My imaging is normal. Yet here we go, right? And then you run the Holter and you get back these derangements and you're like, wow, and it affected so many of the dogs. And, in human medicine, again, this is kind of new stuff for us in veterinary medicine, but in human medicine, we know it's a well-established fact that derangements in HRV analysis, so autonomic disruption, is a direct predictor of number one, progression of the disease, and number two, mortality. So this is kind of important stuff, but it explains why dogs with Chagas drop dead. Okay, and I've lost count of how many dogs that I've heard about from owners. Is I gave my dog a bath. They're doing the zoomies, in the yard after the bath, and then they drop dead. Okay, or I went to bed and the dog was fine, and now he's dead. Okay, that happens very, very frequently, especially here in the South. And so those are the biggest surprises for me, for sure.
You have me thinking back now to all my cardio cases. I'm like, I wonder if any of them had Chagas.
Yep, yep. And if we don't look for it, again, we don't find it, right? But it we tend to kind of get into the weeds, right? So that's another soapbox I have. But we start looking at things like diet, and we're like, well, what about lentils and grain free and stuff like that? Yeah, but you're missing the point, right? We have prevalence rates of Chagas in Texas in companion animals and this is a grossly underdiagnosed number because of the test platforms that they've used in the papers, 18%. So 18% of dogs in Texas have Chagas disease, companion animals, compared to about 16.5 with shelter dogs. That we're talking millions of dogs that are underdiagnosed. And the average, like our reference lab, we have a couple of them that do the testing, serology, but the state lab, which is kind of the tried and true, setup one, those guys test probably, 1,000 dogs a year. So how many are we missing, right?
So crazy to think about. Wow. Well, thank you for doing this podcast episode with us. Hopefully, this is pretty enlightening for folks.
Yeah, hope so. Thank you.
Yeah, of course. For those of you just joining us, we're discussing heart rate variability derangements in dogs with Chagas disease with our guest, Roy.
Roy, again, back to, 20, 25 years, how has all that previous training and experience prepared you to help write this article?
Yeah, and again, I kind of alluded to that earlier about our training, right? Formal training. We were kind of given a little bit different story about Chagas disease. I think the majority of my just experience, seeing it on a literally, I'm not exaggerating, literally on a daily basis when I'm in the hospital, multiple cases of Chagas disease. I think, it's the grunt work on the daily basis that we see in our hospitals that trains us to recognize these patterns of disease. Um, and also, I think on the human side, we've got an international team that we work with for this kind of stuff, and they've been huge in opening up my eyes. So again, drawing from their experience, um, connecting with physicians, connecting with researchers that are doing this, and then taking all the pieces of the puzzle and putting them together. I think that's been my biggest um, help with education for myself is just the wide variety of people in the field that have helped me do it. People way smarter than me, and they've really done a good job of giving me their information so we can help out with it.
So, Roy, this next set of questions is going to be really important for our listeners. And you've given us a wealth of information today about this disease. But if you can really narrow it down to like one piece of information that the veterinarian needs to know when they walk into the door to see that client that may have a pet with Chagas disease, what's one piece of information the veterinarian should know about heart rate variability derangements in dogs with Chagas disease?
Sarah, I would say the biggest one thing that they could focus on is do your cardiac assessment and look for those arrhythmias. Okay, so you're gonna know. I mean, you're obviously not slapping a Holter on everybody as soon as they walk in the door, but you're gonna be able to detect through your physical exam those variabilities. Okay, so you may not be able to get it down to the millisecond, right? Like the AI can do on the Holter, but you're gonna be able to detect those abnormalities in there. So just do your auscultation, pay attention to that, and then if you see anything abnormal, think about Chagas.
Good old physical exam.
That's right.
Tried and true. And on the other side of the relationship, what's one thing clients should know about Chagas disease?
Yeah. So because this is kind of an emerging disease, right? It's an important one, but it's an emerging disease. And so, your veterinarian, might not have had very much experience with it yet. Okay. So as as a patient, as a client, you are your dog or cat or whatever, your companion animal's number one advocate. Okay. So if you have information, if you're listening to this podcast, ask your veterinarian about Chagas. We're generally nice people. Okay. So we'll do what you want us to. So just say, hey, I'd like to have my dog tested for Chagas disease. Now, if you're living in Canada, okay, or you're living in Alaska and you've never seen one of these and then you don't have it, don't worry about it. Okay. But if you adopted your dog from here, in the South, you're traveling, you're doing, agility work, you're at the dog shows, I mean, you're getting exposed, your dog's getting exposed. So just ask your veterinarian and we'll look for those things. Like I said, I learn things every day. My clients educate me a lot. So please don't feel bad about asking your veterinarian to test for this.
I can see Sarah smirking. One of my favorite sayings is every day is a school day.
That's right. Every day. And it never stops, right?
That's what keeps us interested in our wonderful profession.
That's
You
right.
read my mind, Lisa. I was like,
I
is she
know,
going
I
to
can
say
see the
first?
smirk.
I call those growth opportunities, another growth opportunity. Great, super. Here I go again.
I should be much taller than I am.
That's right.
Roy, thank you again. And as we wind down, we always like to ask something just a little more personal. So for you, we'd like to know what's the first concert you attended?
Oh yeah, that's a great question, Lisa. So 1992. I was in high school, and I'm dating myself. The very first concert I ever went to was U2 in Houston. So that set the bar really, really high. It was an amazing concert. But yeah, a long time ago, I think Bono was like the size of a piece of sand. That's how high up we were, but it was amazing.
Did you get a chance to see them in the Sphere?
I did not. Oh gosh, I was thinking about it. Oh, it was so hard to resist, but I would have loved to see them, a lot of years later for sure.
Yeah.
Very cool. It's a fun question. We actually haven't had that one in a while, so thanks for picking that one.
Yeah, you're welcome. Well, you asked me about puzzles, and I was like, I don't do puzzles. That would be a boring answer.
Yeah, that's an interesting one. We have this theory where like internists do puzzles a certain way and surgeons do it a certain way. So yeah,
Yeah,
to be
yeah.
determined. But thank you so much, Roy. We appreciate you being here with us today and sharing information too about your manuscript with our listeners. So thank
Yeah.
you.
Thank you, Sarah, Lisa. Appreciate you guys.
And to our listeners, you can read Roy's article in JAPMA. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode. And don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.